All right, today we're tackling a big one, Insulin Detemir. You might know it by its brand name, Levemir. My goal here is simple, to break it all down for you, what it is, how it works, and how you can use it safely. The whole idea is to help you feel way more confident about managing your diabetes. So let's just dive right in.
So, have you ever really stopped to think about it? How can just one shot of insulin keep your blood sugar stable for like a whole day? It kind of seems like magic, right? Well, it's not. It's actually some really clever science, and we're going to unpack exactly how that works.
Okay, here's our game plan. We're going to look at what this modern basal insulin is, then get into the science of how it works. After that, we'll cover the really practical stuff like dosage and safety, and wrap up with how it plays with other meds. All right, let's kick things off with the basics. Insulin Detemir is what doctors call a basal insulin. Think of it as your background insulin. Its whole job, its only job, really, is to provide the steady foundational level of insulin that keeps your blood sugar in check between meals and while you're sleeping. So, what are we actually talking about here? Well, it's a long-acting, man-made insulin. It's designed specifically to help manage blood sugar for both adults and kids with type 1 or type 2 diabetes. But here's a really key point. This is for steady, day-to-day management. It is not the insulin you'd use for an emergency, like diabetic ketoacidosis. That situation needs a totally different, super fast-acting insulin. Okay, now for the really fascinating part. How in the world does it manage to release so slowly and steadily? Let's dive into the science behind it. And don't worry, I'll keep it super simple. The secret sauce, the real magic trick behind its long-lasting power, is this one tiny, but absolutely brilliant, change. Scientists basically attached a little fatty acid chain. It's that tail you're seeing, onto the insulin molecule. And that one little tweak, that's what gives it the power to work slowly and steadily all day. So here's how that little tail works its magic. Once you inject it, that fatty acid tail lets the insulin molecule latch onto a very common protein that's already in your blood, called albumin. You can think of albumin as like a temporary parking garage for the insulin. By docking there, the insulin gets released super slowly and predictably over hours and hours. And that's how you get that awesome 12 to 24-hour coverage. Yeah, the best way to picture it is as a time-release reservoir. Instead of a huge flood of insulin hitting your system all at once, it gets held back and just trickles out gradually. And what that does is prevent those awful, sharp spikes and crashes in your blood sugar. You end up with a much smoother, more stable day. Okay, so that's the cool science behind it. But now, let's get down to the really practical stuff. Because, knowing how it works is great, but knowing how to use it safely and effectively, well, that's what really, truly matters. First up, dosage. Now, for someone with type 1, a typical starting dose might be about a third of their total daily insulin. If you have type 2 and you're new to insulin, a common starting point is 10 units. But, and please hear me on this, these are just examples. They're starting points. Your dose is your dose, and it has to be figured out with your doctor, based on your body and your blood sugar numbers. It's totally personalized. So where do you inject it? It goes right under the skin, usually in your belly, thigh, or the back of your upper arm. Now, the single most important habit you can build here is to rotate your sites. Seriously, switch it up. If you keep using the same little spot, you can get skin issues, these lumps or pits, that can actually mess with how your insulin gets absorbed. So keeping your skin healthy is a huge part of getting consistent results. Okay, let's talk about the absolute do nots. These are the big ones, the non-negotiables. First, never inject it into a vein or a muscle. That's a recipe for a dangerous low. Second, never mix it with any other insulin in the same syringe. Third, this is not for insulin pumps. And finally, and this is so simple but so important, look at it before you use it. If it's cloudy or has little floaties in it, don't use it. Period. All right, this next part is arguably the most important section of all. Safety and warnings. So let's really focus in here, because this is all about staying safe.
Okay, the number one risk with any insulin, and that includes this one, is hypoglycemia. That's just the fancy word for low blood sugar. This is the main thing you and everyone around you needs to know about and be ready for.
So what does a low actually feel like? Well, you might feel dizzy or shaky, maybe sweaty. Sometimes you get really confused, or suddenly you're starving. Your heart might race. Learning to recognize your specific signs of a low is your superpower. It lets you catch it and treat it fast before it gets any worse. Now, I really want to pause on this next point because it comes straight from the FDA, and it's a big deal. You should never share an injection pen with another person. Not ever, not even if you change the needle. It's just not safe. Sharing carries a huge risk of spreading infections and bloodborne diseases. That pen is for you and only you. So, besides low blood sugar, what else should you be on the lookout for? Well, a few other things can pop up. Some people notice a bit of weight gain or some swelling in their hands and feet. You might also get a little redness or itching right where you injected. And you guessed it, this is another reason why rotating those injection sites is so important to avoid those skin issues we mentioned. Okay, last big topic. We need to talk about how this insulin can interact with other things you might be taking. And this is exactly why it is absolutely critical that your doctor has a complete list of everything you take. And I mean everything. Prescriptions, over-the-counter stuff, vitamins, supplements, all of it. Basically, other drugs can mess with your insulin in a few different ways. Some things can actually boost the insulin's power, which sounds good, but it really just increases your risk of going low. Other meds can work against the insulin, making it less effective and pushing your blood sugar up. And then you've got this tricky category of masking agents, like beta blockers, which can hide the warning signs of a low, like a racing heart, making them harder to spot. So let's just break that down a bit. Things like alcohol or even aspirin can make you more likely to have a low. On the flip side, stuff like steroids or even some water pills can make your insulin work less effectively. Look, the goal here isn't for you to memorize this whole list. The big takeaway is just to be aware that these interactions are a real thing and to make sure your doctor knows everything you're taking. All right, we've covered a lot, so let's just boil it down to the key takeaways. Number 1, Insulin Detemir is all about steady, long-acting background control. 2, rotate those injection sites. It's so important for your skin health. 3, know the signs of low blood sugar and have a plan to treat it. And 4, talk to your doctor. Tell them about every single medication, supplement, and even alcohol use. It's your number 1 safety tool. And that really brings us to the final, most important point. Managing diabetes isn't just about taking a medicine. It's about being an active partner in your own health. So I'll just leave you with this to think about. What's one thing you can do this week to partner even better with your healthcare team and make your insulin therapy as successful as possible?